Welcome back. You are listening to the Mario Mukonda Show on Salam Media on this lovely Wednesday. So it is a World Stroke Awareness Week 2020. It is commemorated on from the 28th of October to the 3rd of November. And would like to encourage people to learn more about strokes and to help them understand what it is and how to get it and how to prevent it as well. A stroke can happen to anyone at any time and anywhere. Today, a stroke is the leading cause of disability worldwide and the second leading cause of death. But almost all strokes can be prevented. Joining me on the line right now is a registered dietitian with the Heart and Stroke Foundation of South Africa, Kinza Hussain. Assalamu alaikum wa rahmatullahi wa barakatuh. Kinza, and shukran for joining me.
Walaikum Assalam, and thanks for having me.
It's a pleasure. All right, so let us start off with understanding a stroke. What exactly is a stroke and how is it caused?
So, a stroke is essentially a brain attack, and it's caused by a sudden interruption in the blood supply of the brain. It occurs rapidly and usually requires immediate treatment. But as you mentioned earlier, it can be prevented. And some of the ways in which you can prevent it is by quitting smoking if you smoke, controlling your blood pressure if you have high blood pressure, maintaining a healthy weight, and eating a healthy diet, as well as exercising on a regular basis.
All right. What are the signs to be aware of when you are getting a stroke? Because I read somewhere that you won't feel that you're getting a stroke. It's not like a heart attack where you can, feel a sharp pain in your heart. But with a stroke, it's something different. So how can you tell?
So, the symptoms of a stroke vary depending upon the area of the brain affected. So, essentially, the part of the brain lacks oxygen. So, what you feel depends on where the stroke occurs. But all strokes involve symptoms that relate to impairment of nerve function. So, some of the signs that you'd look at would be sudden weakness or numbness on one or both sides of the body, loss of speech or trouble talking or understanding speech, loss of vision in one or both eyes, sudden or severe or
I think we've lost Kinza. Must be some connection issues. Kinza, are you still there? All right, so just a moment, guys. If you have any questions for Kinza, please send them to us on our WhatsApp line. That's 061 You can also call us in studio, 01088 Kinza, sorry about that. I'm not sure exactly what happened.
That's fine, no problem. Okay, so I was mentioning just some of the symptoms of a stroke. So I mentioned sudden or severe or unusual headache, and an unexplained dizziness or loss of balance or trouble with walking or a sudden fall, for example. But it's often difficult to sort of keep all these symptoms in mind. So we try and ask everybody to remember the symptoms by using an acronym called FAST. So if we go through this acronym, the F in the acronym FAST stands for face. So if you suspect someone is having a stroke, you ask them to smile and you just observe to see if one side is maybe drooping. The A stands for arm. So you ask the individual to raise both their arms and you observe to see if one side is maybe weak. This S stands for speech. So you ask the person to say a sentence and you assess and check if the speech is slurred or if they're having a difficulty speaking or if it's actually impossible for them to speak. And then the T is for time. And we often say that lost time could be lost brain. So if the individual is experiencing any or one of those symptoms, then it's time to call the ambulance and get them to the hospital fast. So using that acronym sort of helps you to remember the symptoms so that you can quickly check if someone is actually having a stroke and act as quick as possible.
All right, Kinza, we're going to take a quick break, but before we go, I'd like to know who are most at risk of getting a stroke, and let's talk about the ages as well. Are the ages becoming lower now, or what is affecting that? So we're going to discuss that when we come back, but please stay with us.
Sure.
Curtaining, upholstery, wallpaper, and deco. Fabric Direct, quality, price, and a range that speaks for itself. 224 Brickfield Road, Overport, Durban. Fabric Direct, definitely worth a visit.
They say breakfast is the most important meal of the day, yet many children go to school hungry because of poverty. Penny Appeal's Breakfast Club aim to get a warm, hearty meal to underprivileged children so they can spend the day prospering in their schoolwork. Help feed a needy learner by visiting our website on www.pennyappeal.org.za or call 031 1100 573 to find out how you can donate. Penny Appeal. Small change, big difference.
With over 80 years of experience, IG Hussain and Company are renowned for their quality Islamic wear and goods. IG Hussain and Company stock a variety of Islamic items, musallas, kitabs, Medina dates, perfumes and exclusive gifts. We guarantee you a unique and friendly shopping experience for the entire family. Visit our new branch in Overport at 202 Kenilworth Park, Brickfield Road. Open 7 days a week with ample parking and wheelchair friendly. Like us on Facebook or Instagram at IG Hussain for our latest promotions and updates. IG Hussain and Company, your Islamic lifestyle. Connect and stay ahead with Salam Media. This is Salam Media, coming to you live from South Africa.
Welcome back. You are listening to the Mario Mukonda Show on Salam Media, and today we are talking about stroke because it is World Stroke Awareness Week from the 28th of October to the 3rd of November. And joining me is Kinza Hussain, a registered dietitian with the Heart and Stroke Foundation of South Africa. Kinza, shukran for staying on the line. And before the break, I wanted to know about who are most at risk of getting a stroke, and what are the age groups that we should be concerned about? Kinza?
You now.
All right. Must be the network thingy that keeps on making you disappear. Don't worry, I've had that before. But the thing of risk, who should be most concerned of getting a stroke?
So, really, anyone is at risk of having a stroke. The biggest risk factor is actually high uncontrolled blood pressure, but also an abnormal heart rhythm, something which we call atrial fibrillation, can also drastically increase the risk of a stroke. However, most strokes don't have a single cause, but rather many factors that together increase the risk. Having said that, there are some people that are more at risk than others. So, for example, strokes are more likely with age, and women are slightly prevented against strokes before menopause, but then their risk increases. And then rare forms of inherited high cholesterol or clotting disorders can increase the risk of a stroke. Also, if your father or brother suffered a heart disease before the age of 55, or your mother and sister before the age of 65, then you will also be at an increased risk for heart diseases and strokes.
So is there any age group that we should worry about? I know back then we were always concerned about older people, but things are changing with more GMOs, with more, what is that? Anyways, yeah, with more GMOs and all of these other added stuff that are put into our diet, obviously the age groups are decreasing, becoming lower and lower. So should we be concerned about our youth?
Yeah, I think if it's so, definitely the risk increases as you get older. But if we look specifically at the youth, then it's the other more or less uncontrollable risk factors that make them at high risk of stroke. So it's your unhealthy diet, your lack of inactivity, smoking or excessive drinking. So those would be the factors that would then be of worry if we look specifically at the youth. But they, as I mentioned, are more controllable risk factors which we can work on to try and lower that risk.
Mm-hmm. And earlier on, you mentioned about having or maintaining a good weight. So, what is a healthy weight that we should stay within?
So when we're looking at a healthy weight, we one of the measures we use is the body mass index or the BMI. So we're looking, it's essentially a calculation which is weight over height squared, and then that needs to be within a range of, just for an indication, 18.5 to 24.9 kgs per meter squared. That's the BMI range that's considered a healthy BMI range. So according to your height, you need to fall within that range. Your weight needs to fall within that range for you to say that you have actually a healthy weight.
But what if you have more muscle mass? I mean, your BMI will probably be higher because of your muscle mass, and then you are still healthy, but it's just that your muscles are way more than the fat in your body.
Yes, so as I mentioned, BMI is one of the measures, definitely, but there are other measures that we look at, like waist circumference, and we also look at skin folds, but that now goes more, you'll have to go like in and get those measured to actually check and see if you are, still of a healthy weight, and it really is just the muscle. But the BMI is just something that's quick and easy that anybody can sort of use to get an idea of whether they're in a healthy weight range or not.
Okay. And are there any other preventative measures that we can use while we're trying to prevent getting a stroke? I mean, earlier you mentioned weight, you've mentioned diet, you've mentioned quitting smoking, drinking. Is there anything else?
So the smoking, obviously, to quit if one is smoking, the excessive drinking, yes. And physical activity is also very important. And actually, the theme for this year's World Stroke Week is actually don't be the one and join the movement. So the message actually aims to encourage people to get moving and become active. Because it's been proven that consistent physical activity reduces the risk of getting a stroke. So in addition to, trying to live a healthy lifestyle where you're not smoking, not drinking excessively, you trying as best possible to have healthy foods, that physical activity or inactivity actually can be that one thing that might increase your risk. So regular exercise is another thing which we need to try and bring into our everyday living, which can play a role in reducing that risk.
Mm-hmm, definitely. So, if a person has already had a stroke, what can they do then? Are there any? Is there any treatment available for them to get better to where they were before, or is it going to take a while to actually get to where they were before?
So, in patients who have had physical, mental, and emotional deficits because of the stroke, rehabilitation offers hope of increased function and that hope to return to the level of activity that they had prior to the stroke. So the purpose of rehabilitation is to return the stroke patient to the life and level of function that existed before the stroke. But the success depends upon the underlying health of the patient and the severity of the stroke. So it may take weeks or months, and usually requires a team approach for success. So there's physical therapists, occupational therapists, and speech pathologists, which will coordinate care with the primary doctor and physical medicine and rehabilitation specialists. So some of the treatments are directed to prevent life-threatening complications. So for example, speech pathologists may help with speech and swallowing to prevent choking. Physical therapists may concentrate on strength and balance to prevent appalling, and occupational therapists may find ways to allow the patients to perform daily activities, from personal hygiene to cooking in the kitchen. So many patients with significant stroke deficits may require admission to a rehabilitation hospital or a long-term nursing facility prior to returning home. Unfortunately, some patients will have had too severe stroke to be offered that opportunity. But again, the best treatment for stroke is prevention and minimizing risk factors for not only stroke, but for heart attack and peripheral vascular disease. So by positively managing your risk factors, which we've spoken about today, and following a healthy lifestyle as far as possible, you can actually reduce the chance of having another stroke. So it's important to take your medicine regularly if you are on any chronic medication, especially as prescribed by your doctor.
Mhm. Can the Heart and Stroke Foundation assist with the rehabilitation programs?
So the Heart and Stroke Foundation, you can call our health chat line, and you can also visit our website to get a lot more information on any centers or how exactly one can get that assistance, because it's obviously different in different regions, and we are a nation. Our foundation has different branches in different provinces, so you can call us or visit our website to get any additional assistance in that matter.
All right, so please share those contact details for our listeners and our viewers.
Okay, so the number is 021 422 1586, and then our website is www.heartfoundation.co.za.
All right, shukran
I
so
can
much
repeat
for your time.
that. Okay.
Sorry, shukran so much for
Yeah.
your time, and have a wonderful day.
Okay, thank you. Shukran for having me on the show.
It's been a pleasure. Assalamu alaikum. Right, that was Kinza Hussain, a registered dietitian from the Heart and Stroke Foundation of South Africa. If you'd like to know some more information, visit their website, www.heartfoundation.co.za. You can also give them a call on 021 422 1586. Guys, it is World Stroke Week, and it will be going from the 28th of October to the 3rd of November. We are commemorating the stroke. South Africa commemorates World Stroke Week to raise awareness about the symptoms of stroke and the importance of taking treatment for recovery. And strokes are increasingly becoming a public health challenge because they cause death and disability globally. According to the Heart and Stroke Foundation South Africa, strokes claim nearly 70 lives daily in South Africa. Strokes occur when the blood supply to part of the brain is cut off, and without blood, which carries oxygen, brain cells can be damaged or die. Depending on which part of the brain is affected and how quickly the person is treated, the effects of stroke can be devastating to a person's body, mobility, speech, as well as how they think and feel. When patients are cared for, supported to adhere to treatment, and attend rehabilitation programs, the negative impact of strokes can be minimized. Strokes is usually not painful, hence patients may easily ignore the symptoms and not seek medical attention, like what Kinza just mentioned. Use the FAST acronym, which is a face. Look at their face. If it's drooping on one side, arm, can they raise their arm? Are they able to raise their arm? S, listen to their speech if it's slurred. T, time. Time is also important in this, and look at the time of when and how this is happening. Also, try to maintain a healthy weight, quit smoking, reduce alcohol intake, make the food choices such as reducing fatty, salty, and sugary food intake, especially processed foods. Do daily physical activity and manage your stress, and you will be on your way to preventing a stroke. If you have any further comments, questions, queries, or suggestions, do send them to us on WhatsApp. The number is 061 766 0355, or you can also leave them in the comment section below. Don't go anywhere. We will be right back.